Fulgence NIYOMUGABA. I'm Director of Medical and Allied Health Services at Masaka District Hospital. So with our catchment area, we have been lucky of introducing early HIV NCD service integration, so which is helping our patient, if I may say so, but including the healthcare providers and also the healthcare system at large. So starting from the patient, so this service integration is helping our patient, so in early detection of the disease. So currently, when we are doing screening of high blood pressure, screening of BP, early screening of cancers, mainly HPV in women. So it is really helping early detection of the disease among our patients. So the other thing which is there, so this integration is helping in patient satisfaction. It's improving the care that the patient are receiving. So if I may say, so our patients are satisfied comparing to the previous time, if I may say so. So the reason is this one. So before we used to have different appointments to the patient, and also the patient were attending many services at one day. So currently what we are doing, we are having one appointment for NCD, for hypertension or diabetes, then with that one appointment to the HIV care. So to me that the patient is receiving all those care at the same time. So they are improving their satisfaction in receiving care. So the other thing that we are having is medication adherence to medication. So it is really improving their adherence to medication as long as they are receiving their service from one healthcare provider. To me that interaction is really enhancing their adherence to medication. So by going to the staff, how the integration is really helpful to the staff. So it is increasing the confidence of the staff in managing the patient. So here I'm going to give you an example. If someone is treating HIV patient and then after diagnosing high BP, so he transfers the patient to another one. Sometimes the patient may think that this care provider is not really confident or is not providing me the real care that I need. So it is improving the confidence of our healthcare providers in providing the care. But also it's leading to enhancing of knowledge. Imagine someone who was providing HIV care, HIV services only, now has an additional services related to diabetes, to hypertension, even cancer screening. So we are even having some more management related to cancer management. So all that confidence that have been built in our healthcare providers. So let me jump to the system, healthcare system at large. So this integration is really helping us to impact our community in relating to service delivery and improve the service cares. So then the other thing that we are having to related to the system is effective use of resources. So we are having one nurse who is providing the care that was supposed to be provided by two nurses. So the other thing is related to laboratory reagent. So where we had to repeat some more lab tests, in 2 months. We have two kinds of lab tests, two same lab tests in 2 months. So currently we are doing it only once. To me that we are having efficient use of resources among our health system. The issue related to the integration, I may say that we don't have many challenges. So luckily we don't have many challenges, but the crucial one that we are having, it's related to behavior change of healthcare providers. That's the main challenge we are facing, because we are introducing what I can call new things. Does a patient should stay in this service where in the past they were not staying there. So sometimes we can have some staff are resistant to that culture. So and also it's the window that we are having in national treatment guidelines. So that's also related to the challenge that we have, where the national treatment guideline is not really recommending us that the patient in HIV care should be obliged to get all the treatment related to non-communicable disease in that service. So that's one. Okay, it gives the room for the resistance to healthcare providers, but really that's the main challenge that we are facing currently. So the other one, it's related to maintenance of some materials, mainly BP machines. So we are having those BP machines in our services, but they are not regularly used, not regularly functional, because we are having some challenges related to the pirates. So it's really the issue which is related to that maintenance, but it's really related to still it's that behavior that we are saying, because we are health centers, hospital have the capacity of maintaining them, by the way. So when you find them not maintained, it's really still come to the behavior of the healthcare providers, the behavior of the in charge of services, so that the materials can be maintained. Thank you. HIV and NCD service integrations, so it have been response to their request, by the way, if I may say so. So mostly there are no challenge. There are no challenges related to the patient. So some health providers came up saying that NCD service they needed to pay the certain amount of money so for receiving the service, while in HIV service they were not really paying. But what is really here the reality? If that patient is really required to pay, so even if we don't do integration, they will repay, by the way. They will pay in the OPD, they will pay in NCD service. So it's not really challenge. The challenge can come in if the patient is not having the health insurance. But most of our patients, they have health insurance and they know that services, healthcare services, they should be paid at all. So I can confidently say that there is no patient who is missing service because they are paying NCD service, as long as it is not additional cost to the healthcare services. We are not asking them to pay for HIV care, so they are all paying for the service that are regularly should be paid. So the only matter that we may be having